We're creating a digital health platform that empowers the individual by giving them the tools that they need to predict and understand their own health.
So the people utilizing this platform, initially we thought would be the early adopters, the people that are just really interested in their state of health and having a better life. But the COVID-19 pandemic has basically made this an immediate need, an immediate reason to jump on this and make something happen. So the disruption of what's about to happen in the, not just the healthcare system, but in the entirety of humanity, I mean, this is a global event, is going to force us taking creative looks at how we get beyond the sick care system. So in the state of health where you're using pills and surgeries, I think this is the way that predictive medicine and precision medicine, our individual precise way of treating our bodies, is the way to go. And that's what this platform provides, is choice.
I love the idea of this platform because what it does, it puts the power of my own health into my own hands. It provides me with the information that I need, not just to have the information at my fingertips, but to actually understand the information so that I can make well-informed decisions about my own health. By doing something that is predictive rather than reactive, everything we've found in the market so far has been a reactive type of a thing. So I would like to have something that would help me predict what's about to happen. So if I were to change my behavior, what would happen? If I go down a bad path, what happens? If I do the right thing, what happens? So it helps me forecast where I'm headed and what I need to do to actually achieve my own optimal health.
The aha moment for me was when I was working on a massively transformative purpose, trying to find significance in my world. And I realized that health has always been important to me. And I didn't really feel like the system was supporting me. And so the concept of being able to take control of my own health, track things, predict what might happen, and not wait for something to happen to take a pill or have surgery. I'm more interested in having that avatar or maybe a digital twin where a representation of myself is out there and it's actually behaving as though I was eating the wrong thing or not exercising enough or exercising too much. And so the digital twin was spawned from that, and we've got a team that's willing to put that together. So this healthcare platform is basically going to allow us to track and predict our state of health and make changes accordingly.
I love this idea of the digital twin because it gives you a way to understand what is usually abstract and completely unfathomable information. It's a way for me to take this information and map it visually, a digital something, which is a representation of myself, so that I can see visually what is going on inside my body. And what does it mean when I do something versus cause and effect, right? So I can do that, and it's a forward-looking process. It's not back-looking. Everything I've seen so far is back-facing, right? It's not forward-facing. So yes, you might know where you are and where you've been, but by taking that and combining with artificial intelligence and the pathway that you might be headed, you can then have the power to rewrite the end of your own story by changing my actions, by changing my attitudes, by changing my behaviors, and then I can physically see that in my twin and in myself, and it will validate everything that I'm doing.
The short-term implication is that we're going to knock COVID-19 on its head. This is something that has disrupted the system so that we can take action right now and start to predict what's going to happen, flatten the curve, get it out of the way. The long-term impact is basically going to be changing the healthcare system. Instead of sick care, symptom-based treatments, we're going to be knocking it on its head too, and we're going to be able to predict the state of change in our bodies. We're going to be able to command and control exactly what we do and how we do it. And so I believe that the long-term impact is so much bigger, but the short term is the reason we need to start right now. And we'd love your support.